Hello, my name's Clare Humphreys. I'm a Public Health Specialty Registrar. Whilst I was in phase 1 of the Public Health Specialty training, I was based at NHS Wakefield District, which is a primary care trust. One of the pieces of work I undertook whilst I was at the primary care trust were 2 needs assessments, one of HMP Wakefield and one of HMP Newhall. HMP Wakefield is a high security male prison and HMP Newhall is a local female prison. Both are located within Wakefield District, and therefore the Primary Care Trust has responsibility to commission healthcare for these 2 prisons. A health needs assessment is a tool commonly used by public health specialists. It's a systematic way of reviewing the unmet health and healthcare needs of a defined population, which is used to address these needs in a cost-effective, efficient and equitable way. The NHS have a responsibility to commission healthcare of the prison population. They follow the equivalence of care principle, which is that prisoners should have the same access to healthcare in prison as we would on the outside. Prisoners tend to have worse health than the general population that need to be addressed whilst in prison. In addition, identifying ill health early on prevents complications later down the line and the development of long-term conditions, which are expensive to treat. They also might necessitate hospital visits, which are expensive not only for the prison itself, but also for the NHS. Prison can identify healthcare issues and lifestyle issues that can easily be treated whilst the prisoner is in prison and hopefully be referred on to appropriate services once they are released. This includes drug treatment services, and it has been shown that drug treatment services actually contribute to reducing reoffending rates. The first stage of a needs assessment is to understand the population in question, to define it. Then we need to look at the health needs of that population, how they're currently being addressed and whether there are any unmet needs. To define the prison population, I use data from the prison service itself, demographic data like age, ethnicity, length of sentence. For the health issues, I looked at the literature around offender health, which gave me an indication of the common issues amongst prisoners in this country in similar prisons, but also other health needs assessments undertaken both in Wakefield and Newhall and in other similar prisons. I also looked at the literature around offender health, what would expect the issues to be amongst offenders in prisons in the UK, amongst certain types of prisons. Also, I looked at health needs assessments from other prisons and from Wakefield and Newhall prisons itself. This is only part of the picture though. To really understand the data, we need to talk to the people involved in prison health. These are the stakeholders. These can be prison staff, such as prison officers, healthcare staff, voluntary organisations, the prisoners themselves and NHS commissioners, all of which influence the health of prisoners. I arranged informal interviews with all these different stakeholders, including focus group discussions with the prisoners themselves. This is to get an idea of what they think the health needs are and what are the problems with the health services as they stand, and what are the good things, what's working well, what doesn't need to be changed, which is very important to get a full picture of what's going on, to identify the unmet need, what's currently happening and whether there's what we can do about it. A health needs assessment is a useful tool for anybody interested in the health of a population, such as local authorities and voluntary organisations. It can be conducted for a defined population, such as the health needs assessments I did on prisons, but also for a particular condition or issue, such as diabetes or asthma. It also uses a number of different skills, including synthesising the evidence, data interpretation and analysis, communicating both in writing and verbally, liaising with a variety of stakeholders and building partnerships, and using all of these things to make evidence-based recommendations and influence people.